Hello and welcome to the Good Growth Podcast. You might remember in Season 2 we spoke to Lord Victor Adebowale about bridging health inequalities in society. Well, today we focus on the role society and community has in healthcare, to a global issue on a local scale. With Good Growth based in Exeter, this is particularly close to our heart, and we want to celebrate what the NHS has done in both treating COVID patients and in rolling out the vaccination programme. We're specifically focusing on the Royal Devon and Exeter Hospital as one of the big innovators of a digital operating platform. We'll get into that a bit later, but first let me welcome our guest, the Chief Executive of the RD&E NHS Foundation Trust, Suzanne Tracey. Suzanne, warm welcome to the podcast. How are you?
I'm fantastic. It's Monday, the sun's shining, and the start of a new week. I always feel really optimistic, so I'm feeling really good.
There's something about the spring sunshine, Monday morning. Nice sense of optimism, I think, about the week, I hope.
Absolutely.
So, Suzanne, you've been working in the NHS for close to 30 years now. Can you give us a bit of background as to how you've started out in the NHS and how you've seen it just transform, I suppose, during that time?
It's really scary when you say it's nearly 30 years because it's flown by. It really has. I've enjoyed it so much. But I joined the NHS back in '93. At the point at which NHS trusts were being sort of conceived and coming into being. I trained as an accountant, actually, with one of the big four firms, and had sort of just qualified in public sector and accountancy, which was fairly unusual in Pricewaterhouse at the time. But a number of my clients were NHS or sort of working with NHS and local government clients. But it just seemed like a really exciting time. And I thought, if I'll sort of go for a couple of years, get some breadth of experience and then come back into the firm. That was my original intent. But like you say, that's nearly 30 years ago. And every year has been different, and every year has been really exciting with great opportunities, loads of challenges as well. But there's been quite a lot of change, as you can imagine, over that period. Like I say, when I started, it was around the time when NHS trusts were being formed, and that gave a lot of focus on individual organisations and what they could do within their own arrangements. And then we created foundation trusts in the sort of early 2000s. And now we're coming back full circle, and the whole focus is on system and how organisations work together. So I think if you stay long enough anywhere, you sort of see that full cycle, don't you, go round? And it's been really interesting, really interesting.
I can imagine there's never a dull day in the NHS, but
There really isn't.
You mentioned the Foundation Trust there. You're Chief Exec of the Royal Devon and Exeter NHS Foundation Trust. Can you just, for those who might not be so familiar, just explain a bit about what a Foundation Trust actually is?
I can, yeah. So they essentially are not-for-profit public benefit corporations. I mean, that's the best way to describe them. And they were conceived as a way of trying to shift the sort of centralised and national decision-making right down to local level. And so foundation trusts were formed with quite a lot of freedoms, certainly back in the day, quite a lot of freedoms, both financially and from a decision-making point of view, and in terms of having almost control over their own destiny with less sort of input, still having to follow clearly what national direction is and the national standards. But actually the way that you do that was really defined by foundations trust themselves. And that gave us lots of freedoms. And the Royal Devon and Exeter was one of the first 10 trusts in the country to become a foundation trust. And I guess at that point, it was very much really thinking about, so what does this mean and what can we do? But I think, we've been able to really secure some significant investments because trusts were free to borrow. They didn't have to just have capital from through the sort of through the central government route. And so you really have the opportunity to think about what's important, what do we need to do, and then to, as long as your business case is passed muster, then to sort of secure that capital and move forward, rather than having to be part of an overall prioritisation system. So it's much more nimble. Really being able to focus on what was important for local people, as opposed to necessarily what people centrally, albeit in London, thought was right for the Southwest and right for Devon. We were able to really connect with local people, and a really important part, and I think we'll probably come on I'm sure we'll talk a bit more about it, is the role of the governor in a foundation trust. So governors were created to, in fact, hold the local trust accountable. So accountable for delivering on the strategy and objectives that are set for, by each trust. And so our governors sort of hold us to account for doing that. And that's a really important link for us, back with our local community, and really making sense of what makes sense to local people.
Yeah, so really that governor role is, I guess, projecting the voice of the local, of the community, of that, adding that locality to the National Health Service.
That's exactly it. I mean, look, the NHS is the principles of the NHS remain constant wherever you are. So, free appointed delivery, common standards, common requirements for us to meet under regulation. But actually, the nuance of what's particularly important for our own area, and of course in Devon, and we sort of serve the larger catchment area of sort of East Exeter East and Mid Devon. That larger catchment area, sort of encompasses urban, rural, coastal. So, it's not going to be the same given those very different geographies in terms of what's important to people. So for some people, out in the rural areas, then actually access to services and transport are really important factors for them. But it could be something completely different if you live in and around Exeter. So we're really able, through our governors and through that local accountability, to really take into account what's important in those very different circumstances. And I think that's really important.
Yeah, that is an important point you touch on there, because it isn't just the Exeter, the core Exeter area. That you've got, Mid Devon, East Devon, really rural areas in places. And so the needs of people in those areas are much different to those living, say, in central Exeter. So having that governor role, I can see how that helps you quite a lot.
No, it really does, yeah.
So generally, what you've mentioned, I think that sort of projecting the voice, I suppose, that locality. What other benefits do you think there are to this type of or to a foundation trust in this sense?
I think it's also a bit about attitude. I know that might sound a bit strange, but what I've found is, and I've sort of worked across both. In actual fact, over the last couple of years, I've also become Chief Executive up at Northern Devon Healthcare Trust, which is based up in Barnstaple. And that's still an NHS trust as opposed to a foundation trust. And I think the difference is the sort of regulatory regime that certainly came in place when foundation trusts were formed. The onus was on the board of directors to ensure that whatever was happening, that they were within their sort of working to the terms of their licence. So that responsibility, if you like, and that accountability was really strong, clearly with the local organisation. And so I think for me, there was more about the autonomy, really ability to drive innovation. And that's not saying that, NHS didn't do some of that stuff, but we were just working in a different set of conditions and environments. And that led to different behaviours. So, it's been interesting working across the two organisations and just really noting some of the difference. But fundamentally, we still, both organisations are still focused on the same things about, quality of the services we deliver, the safety of them, how we can get the best use of our resources in terms of, efficiency. So all of those things are really still important, irrespective of what type of organisation you are. I think it just comes back to the rules and regulations of how you can operate that feel different.
So what is it like for you, really, leading such an important part of the health service? You've got a lot of different factors going to play. We've touched a lot of things that are important. There's a lot of things important to a lot of people. What is it like for you, having all of that, and I guess for you to be able to distill that down into what you need to do for action, I suppose?
Yeah, if I stop and think about it, sometimes it's really scary. From the point of view that these are large and complex organisations. I was sort of recruiting to a key leadership role a couple of weeks back, and sort of talking through with candidates and talking about what we were trying to achieve over the next couple of years. And it's a massive agenda, as you can imagine. These organisations, I think, between the two trusts, it's sort of, £750 million worth of turnover, 13,000 staff, numerous locations right across the county. And so the complexity of what we're trying to do, I think if you stop and really, really think about it, that's where it's scary.
Mm.
But I think fundamentally, this is just a huge privilege. I mean, being a chief exec or being a senior leader in these organisations, it's just a massive privilege, because you get to sort of, when you get out of bed in the morning that whatever you do during the course of that day, in some respects, in one way or another, is just going to have a fundamental effect in terms of somebody's life, and that's really never been more obvious than over the past 12 months during the COVID period. And when you sort of receive letters and all sorts of things actually that people have sent in, local people have sent in, just to explain how important the work we do is, and how much they've benefited personally, or have in some cases had an impact in terms of saving their life. I mean, where else do you get an opportunity to have that much of a direct and positive impact? It really is. It really is. It's the best job in the world. Look, I could tell you that it's the best job in the world. It's made me go very grey, as you can see, but it is the best job in the world.
I can imagine that's an incredible feeling, but and like you say, if you stop to think about that too, it's quite daunting and overwhelming, but hugely rewarding at the same time. You mentioned COVID there. I mean, like all health services around the world, Royal Devon Exeter has been no exception to obviously having to respond to COVID. What were some of the innovations that you adopted during COVID? And are there any there that you'd actually take forward into a post-COVID healthcare?
Yeah, so it's been the most challenging, and in some respects the most challenging, a period of the NHS full stop, and certainly of my career. But then in others, it's been, it's given us massive opportunities. And I think, every year as an organisation, you sort of, as a health organisation, you're required to sort of look at your pandemic plan and what you were going to do, which you do, but you never think that's ever going to happen, do you? Why would you think that was going to ever sort of really, really happen? And then all of a sudden it does. And you look at the plan, and of course it gives you a good start, but, you can never truly take into account what you need to do to respond until it happens. And of course, we were really sort of having to step back, think about what was important, and respond in the here and almost in the here and now. And that's been great, because what we've seen as a result is things that might have taken forever to achieve in normal times have happened overnight. So some of the reconfiguration in the hospital, for example, that we might have wanted to move departments from one area to another, it literally happened within the space of weeks, when I think in normal times, when you're just trying to run the business as usual, that some of those things are really difficult to do. So we saw some really significant shifts in terms of just how we run services, and not only in terms of how the sort of hospital environment themselves looked, but really sort of taking up the opportunities for digital and the use of technology. So the amount of our services now that can be accessed virtually is fantastic. And again, talking about that sort of rural environment across Devon, and for people travelling, vast distances to maybe come for an outpatient appointment or whatever, a lot of it now can be done online, and wherever we don't have to physically see somebody. Then virtual appointments, I think, have been really important, and the feedback from our patients and local public is that they love that opportunity. They don't have to travel a long way, find a car parking space, find their way around a really busy hospital. They've been able to sort of do something really quickly and really immediately.
Yeah.
I was last week visiting on the North Devon site, and we've actually got a drive-through facility. And again, it's for people who were most vulnerable, didn't need to come into the main hospital site. They could literally roll up, have the test that they needed, cardiorespiratory test, and drive off again. And it was all done through their car window.
Wow.
And again, you just think, We wouldn't have thought of some of those things. So there's been fantastic, and speaking to and visiting with our staff, the level of innovation and just that people have really thought about what's important to patients and really shifted their services accordingly. So I think there's lots of stuff that I think we'll take forward, and we wouldn't want to lose from the pre-COVID way of working. I mean, even just some of the flexibility of how people work, and sort of reducing the congestion on our roads because people aren't having to all get to head into the hospital and whatever.
Yeah.
But I think the biggest thing is that when you work in large and complex organisations, invariably people can feel that the bureaucracy of those organisations sort of stops them making or stops the innovation or stops the change. And whether that bureaucracy is real or perceived, it can be a constraint. And I think what people have found really empowering about the last 12 months is that there hasn't been, for obvious reasons, we've had to respond really quickly and be much more nimble. People have really sort of felt empowered, and I really want to continue to engender that sort of environment going forward, so that all of our clinical teams and indeed our sort of corporate areas, if they see something that's going to be the right thing to do, that they're well able to sort of move that on and not feel that they've got to ask permission and get approval. So I think for me, that's one of the biggest takes of the last 12 months is how do you continue to create that sort of that type of environment.
Yeah, I think it's a theme we've actually noticed across a lot of the podcasts. Particularly during the last 12 months or so, is that decision making is sped up because you have that pressure now. I mean, there's always pressure, but this is sort of an increased pressure to make these decisions, and not just in healthcare, but we've even touched on like sort of fashion and industries like that. There's different pressures for different people, but they're all confined around that aspect of time, I suppose, where decisions need to be made now, and so that efficiency, and like you say, that empowerment, I think of staff to be able to go and make that step is actually quite refreshing to see.
It is. It really is, and it's given people a sort of a real motivation, different motivation, more enthusiasm. I mean, people are tired. Of course, they are. It's been a tough 12 months. But what I sense is a real feeling of optimism and ability to really sort of embrace change and move things forward. And that there's a real buzz about the place. It's brilliant. It is really good because I think it meant that we had to sort of step off the hamster wheel, if you like, of just doing things in the same way as we've always done, and really sort of stop and think, okay, what's important here? How do we achieve it? And then move it on really quickly. And I don't want to lose that because it's been great.
I just want to quickly touch on the Nightingale hospitals, actually, because you're one of the few trusts to utilise the Nightingale Hospital in Exeter, and I think you've recently bought the facility. So by having that now, what does that add to the trust and community going forward?
Well, look, the Nightingale brand was a sort of national initiative to create extra bedded capacity in recognition of just how many patients potentially could need to be in a hospital setting. And the decision, it was a national decision to sort of create a Nightingale in our local patch. But given the geography of it, we did take responsibility for hosting the facility, even though it was available to all organisations or all patients in Devon, and in actual fact, right across the southwest, because we ended up, because the figures were lower in Devon, we ended up sort of taking people from right across the southwest, the southeast, and up to Birmingham. And it was a fantastic facility. So, we took a sort of a retail unit, and over the space of 13 to 14 weeks turned it into what is actually a really impressive healthcare facility. And what we didn't want to do was to lose that when the need for sort of COVID occupation came to an end. So we've been fortunate enough to be able to purchase the facility, as you say. And what we've got to think about now is, of course, whilst we have the response to COVID, how do we actually recover from the backlog that invariably exists because we've not been able to carry on treating patients in the same way. And so we're really, at the moment, we've quickly, as we didn't need it for COVID, we've quickly reverted to using the facility for diagnostic testing. It's sort of well placed for that, easy access from the motorway or the A30, and and we can sort of just confine, and because we've had restrictions on how many people can go through the main site because of infection control arrangements, then we've been able to have this other site that we can use for diagnostic purposes. But we're really doing a bit of an option appraisal at the moment to say, okay, but what do we really need into the future? And whether it continues to be diagnostics, or whether it helps us with our elective service recovery, then it will have I think, a role for certainly for a long time to come in terms of giving us just extra facilities. Because of course, whilst COVID has reduced in terms of prevalence, the amount of people we have in the hospital, with the infection control implications for us is still huge. And so for many of our services, they're not able to physically see as many people as they've previously been able to pre-COVID, because they've got to allow for social distancing, all of the infection control arrangements that we take in between every patient that comes in and out. I mean, it's just really sort of impacting on the amount of patients that we can see at any one point. So having that flexibility is really brilliant. But it's great. It's a really great setup, and what was achieved over such a short space of time is just phenomenal. It really is.
Yeah, incredible. Again, going back to that decision making and that need to do things quickly, it is impressive as to what you can achieve.
Well, my estates departments hate it, because I say to them, when we're just rebuilding our emergency department, and my phrase now is, well, we could do Nightingale in 30 weeks. Why would it take him 2 years to do either?
Exactly.
And they're like, oh no. So
set the bar now.
Set the bar, and yeah, we sort of trying to hold them to account for that one. But yeah, we were very lucky. We had lots of help. I mean, we had military personnel deployed to us. I mean, it was a phenomenal effort, actually, right across a number of sectors, just to make that happen. It was really great to see.
Final sort of area I want to cover, and just I guess bring it into the digital world a little bit. You've introduced a digital operating platform called Epic, and that I believe is there to sort of help transform how your clinical care and your patient experience is delivered. Can you just give us a bit more about what Epic is and how that helps you improve the quality of your care to patients?
So I think I guess that because all other areas of our life is sort of so technically or digitally enabled now, we sort of expect that the NHS is in the same boat, and I don't think we have been. We're sort of quite outdated in some of the systems that we're using. And Epic is an integrated electronic patient record, and it essentially brings together all aspects of patient care into one place and under one sort of system. So we introduced it we went live in October last year. So not necessarily something you'd plan for, going live in the middle of a pandemic response. But we'd had several years of preparation work up until that point, and we didn't want to miss the opportunity. But what that does is it actually brings, and if you think about a hospital, and we've already said they're sort of large and complex places, it brings all aspects of a patient's care it connects it together. So previously we had lots of disparate individual systems. If we had a blood system and an X-ray system and an outpatient system, but none of them would sort of talk to one another because they came from different companies and different places. But this now is all integrated. So for a staff point of view, if they're looking after a patient, everybody can see the same information at the same time. So whether you're in the community part of our organisation or in the main hospital acute side of things, you can see what's happening for an individual patient. And of course, that means that when we're planning the discharge of a patient, our community team can see exactly what the acute team can see. And that's really helping in terms of how we organise ourselves and how we arrange our services accordingly. But for patients, I mean, again, a huge difference. So, a lot of our services were paper-based. And so every time you came to hospital, you'd be given your details to numerous times to different people every time you saw them. You give your details once, and everybody can see an update. You have access to key elements of your medical records as a patient using our patient portal. You can book your own appointments. And actually, it just gives you the ability to take much more control over your sort of healthcare and your well-being, which is something that I think the NHS is really trying to achieve, which is to sort of move less from we're the caregivers to the responsibility and the ownership is with citizens as individuals, and we become sort of partners in that individual's healthcare, or supporters of, rather than caregivers. It sort of changes the dynamic, I think. And I think that's what society wants today. They want to be able to, people want to be able to have much more direct control. People are much more better informed with the internet and all the rest of it. And so the patient portal, My Chart, which is what we've got through Epic, allows people to do that much more. So it's had a massive impact already in terms of just the capability. It's really exciting. It's really exciting.
It sounds massively important to helping staff deliver better care, because they've got obviously better visibility of that patient, but also making the patient experience a lot more just simplified, a bit more, obviously coming to hospital for any patient is somewhat of an ordeal. It's not, no one wants to do it by choice. So making that experience a lot more just pleasant and understanding sounds like it benefits both the NHS and the patient.
Yeah, no, absolutely. So I'm really hoping that, we've the implementation itself hugely complicated and really resource intensive. And as I say, we went live during a period of of huge challenge for us. So we're now in the stage where we're sort of stabilising the position, optimising it, and really thinking about what this enables us to do. And I think this is the biggest step change, certainly for the Royal Devon and Exeter in its history. That's how I've described it, because the possibility, or the art of what's possible as a result of digitally enabling the trust is phenomenal. And what's brilliant is just listening to our clinical team saying, "Oh, well, we think we could do this now as a result, or we could do that." And I think it will fundamentally change healthcare in the way that we know it. I don't think in the future we'll be sticking to the tradition of visiting your GP, having a referral onto the hospital, having an outpatient attendance, maybe an inpatient, etc. I think it will really start to change over the coming years, and that digital capability will be a huge enabler in terms of doing that, and that for me is really exciting.
Yeah, hugely exciting times by the sounds of it. And also what I'm taking away from this as well is that whilst obviously the pandemic has been an extremely tough time for a lot of people and for the NHS as well and its staff, that off the back of it there are some positives coming from it in terms of just the empowerment, the ability to make decisions quickly, and deliver a better care going forward. So through all the tough times, there's certainly some light to come from it as well.
I think you're absolutely right, Dan. It's I think when you get any significant change, whether it's planned for or not, in the case of the pandemic, it does give you the opportunity to stop, think, do things differently. And that's been really good. And I think also for us in health, it's been fantastic to just know how much people appreciate the work that our team has been doing throughout. And I think that's been very humbling and very motivating at the same time. So I think it's really sort of given our team, given our staff a sort of real boost in terms of the job. And actually, we're seeing an increase of people who want to now come and work in the NHS, which is brilliant. And as I said, I think a little while ago, it's the best job in the world. So why wouldn't you want to come and be part of it?
Absolutely. Suzanne, great fun talking to you, and huge pleasure as well. Thank you for coming on. Appreciate it very much. Thank you.
My pleasure. Thanks so much. Nice to see you. Take care. Bye now.
Thank you for listening. And remember, you can go back and listen to any of our other podcasts on Spotify, Apple, and the Good Growth website, goodgrowth.co.uk.